Welcome to Laser Quantum Therapy. In this episode, we'll learn about the precautions that are necessary whenever performing laser therapy. Hi, my name is Ron Henry. I'm a chiropractor, acupuncturist, and naturopath. Laser therapy poses certain unique risks that are not found anywhere else in healthcare, such as in relation to the eyes and certain endocrine glands as well. Treatment with laser is generally avoided in cases such as cancer, avoided on the abdomen during pregnancy, and avoided over the chest region in patients with pacemakers. Also, we avoid treating actively bleeding areas, such as the skull, in the active bleeding stage of a stroke. Precautions must also be taken in individuals with tumors, and in those currently taking steroids, and in many non-steroidal anti-inflammatory drugs as well. In order to be effective, laser should not be applied through clothing or bandages. Glands in general must be treated with more caution than other regions of the body, considering that laser therapy for the thyroid, the ovaries, and the testes continues to be fairly controversial. If one chooses to apply laser to these areas, only lower powered devices are recommended, and experience has shown that increased sensitivity may occur in some people with the thymus gland as well. When lasering any portion of the head, including the brain itself, one of the main cautions is to use only lower powered devices in order to avoid any overheating of the sensitive neurological tissues of the brain itself. This precaution appears to be less necessary when we're treating along the spinal column. Although rare, side effects from laser therapy have been observed on occasion, but it is pretty rare, including even with the use of low-level Class 3B devices that are operating at less than half a watt. These may include reddening of the skin, temporary increase of local pain, fatigue, sweating, and dizziness. And all of these will almost always fade without any lasting ill effects. These reactions may be more pronounced with Class 4 devices, especially regarding reddening of the skin and temporary aggravation of local pain, both of which will usually subside in a pretty short period of time. The general condition of a patient should always be taken into account, such as their age, the nature of their symptoms, and any previous treatment, including medications that they're currently taking or have recently used in the past. When applying laser therapy in acute conditions, it is often wise to begin with a lower dose to lessen the likelihood of any temporary aggravation of the symptoms. And for many individuals, this also applies when addressing longer-term chronic conditions as well. When performing laser acupuncture, be particularly cautious when treating points around the eyes. Points found in the pelvic region in females, like we mentioned, and points located in the throat region because it's in the area of the thyroid gland. In general, eye protection should always be worn when performing or receiving laser therapy. And this is especially true when using higher powered devices. Learn more at laserquantumtherapy.com, and to purchase our books, go to amazon.com.